Good morning, everyone. I will be presenting to you my report about the Trigger 1. Today's discussion, let us review first the Trigger 1, then my learning issues, resolutions, and last but not the least, my answers to the given questions. Mr. R is a 35-year-old male who presents to his primary care physician with cough for the last 10 days. He explains that his 6-year-old son had fever, runny nose, and cough about 2 weeks ago but got better after a few days. He explains that he got sick shortly after him and developed nasal congestion, sore throat, and a productive cough. While his congestion has improved, he continues to cough and is concerned that his symptoms persist. He denies any fever, chills, dyspnea, or hemoptysis. His physician provides him a diagnostic request for chest PA X-ray examination. For the learning issues, the first thing that came to my mind are the medical terminologies mentioned because of those terms are not so familiar to me. So first we have primary care physician. What is primary care physician? It is a healthcare professional who practices general medicine. They can treat conditions in their own clinics, and they are typically patients' first point of contact when they have medical concerns or needs. Second, what is dyspnea? It is a condition where you are experiencing shortness of breath or a uncomfortable sensation of breathing. You may experience dyspnea when you are at rest or when you are performing an activity, no matter how small. This condition also occurs on persons having heart and lung problems, asthma, hyperventilation, and environmental pollutants such as chemicals, fumes, dust, and smoke. Next is what is nasal congestion? Nasal congestion or stuffy nose are in Visayan term pingot. It prevents the flow of the air in and out of the nose because it is the result of inflammation and swelling of the lining tissues of the nasal passages and sinuses. It is annoying especially when we are sleeping. Common causes are common cold, flu, sinusitis, and allergies. Next is what is chest PA X-ray examination. PA means postero-anterior X-ray examination. The patient stands facing a flat surface behind, which is an X-ray detector. It is performed typically for cough, shortness of breath, and chest pain. And lastly, what is productive cough? It is when you cough that produces mucus or phlegm. It gives you a feeling of congested and tight chest. The last symptom you will experience after the common cold. Let's now proceed in the last part, which is my answers to the given questions. Number 1. What healthcare facility where Mr. R will be going to undergo his chest PA X-ray examination? Mr. R will be going to undergo his chest PA X-ray examination at a primary healthcare center because chest PA X-ray examination can be performed in any clinic and diagnostic laboratories, like for example, Health Check Clinic, HI Precision Diagnostic, and St. Ignatius Medical Clinic. Number 2, categorize the healthcare facility according to bed capacity, specialization, and modalities. Category 1, because primary care center, healthcare center belongs to category 1. Usually, basic laboratories are performed like CBC, urinalysis, X-ray, and many more. And last, what specialization will Mr. R undergo chest PA X-ray examination? The specialization that Mr. R will undergo is X-ray examination. And that is all for today. Thank you for listening.